Hey, the verdict is in, and guess what? I'm going to be covering in this video what is the very best Medicare supplement in 2026 and exactly why the supplement is the best. Stick around, we'll be covering that today in today's video. Hey everyone, it's Calby Hightower with Medicare Hub. I'm going to walk you through exactly what is the very best Medicare supplement plan for 2026 and exactly why that plan is probably the best plan for you. One of the things I'd like to be able to walk you through before we get into what plan is the best, and I'm going to cover that at the very end, is I'm going to walk you through a couple of basics to ensure that you understand how to get in a Medicare supplement. One, to have a Medicare supplement plan, a person is going to have to be enrolled into Medicare Part A and Part B. Two things that happen typically in this situation. One, the population of Americans that are just in original Medicare is about 11% of the population that only has original Medicare Part A and Part B. This means when you go to the hospital, you pay a Part A deductible. And then when you go to outpatient services outside of the hospital, you pay a Part B deductible annually, and then you pay 20% of the billable rate. Now, while in the hospital, if you pay a deductible that covers up to 60 days, 61 through 90 is so much per day to stay in the hospital. 91 through 150 days, it costs so much per day to stay in the hospital. And then beyond 150 days on original Medicare, you begin to cover the entire bill yourself. So original Medicare Part A is pretty expensive because it's a little over $1,700 right now for a Part A deductible. And then if you have a doctor come into the hospital from the outside of the hospital to work with you, like a specialist, they're going to bill original Medicare through Part B services. You're going to pay a Part B deductible that's annual and then 20% of the billable rate. So Part A, Part B is going to be extremely expensive. Therefore, that's why people enroll into a Medicare supplement. Now, to specify exactly who can enroll into a Medicare supplement, it breaks down on when you're enrolling and what is going on in your life that allows you to enroll into Medicare gaps or Medicare supplement plans. So one, if you're turning 65, you have an eligibility window that allows you up to 6 months to enroll into a Medicare supplement without any underwriting questions. So this is very important because if you're sick or unhealthy or you have health conditions or chronic illnesses going on, a lot of times if you wait past the 6-month period, you're going to have to go through what they call manual underwriting for each carrier that you're looking at. Now, there are also states out there, they have birthday rules and things like that. So you may be in a state and be enrolled into a Medicare supplement and looking at an option to change on your birth date month. That's going to apply because of the birth date rule for the state. But in the state of Tennessee, we don't have the birth date rule. So if you don't enroll in your enrollment period, your initial enrollment period time frame, that's 6 months, when you turn 65 or when you originally go on Medicare, that could be coming off an employer group plan, you're going to have what's called a guaranteed issue period. And that's going to happen because when you are coming off of an employer-based plan or going on to Medicare for the first time, they give you a window of time called the guaranteed issue. And again, you're going to be guaranteed issue based on your eligibility to enroll into Medicare. And it doesn't associate with your turning 65 age. For your initial enrollment period, it's going to be associated with coming off a credible coverage plan and enabling you to be guaranteed issue. And I'm going to explain a little bit of the details on that before we dive into what is the best Medicare supplement plan for this year. So guaranteed issue and initial enrollment period and SEPs, and there's all these acronyms that Medicare throws around. A lot of times it gets very confusing. That's why one of the things we often educate people on is one, have a licensed independent agency that knows what they're talking about, especially when it comes to aging into Medicare, especially the rules and regulations around employer group plans, group coverages, the size. You may not know this, but it's very important to understand if you're in a group coverage plan for an employer and you have less than 19 employees, Medicare mandates you to go on Medicare Part A and Part B, and then you're going to be in first payer position with your Medicare, and your second payer position would actually be the employer plan. In larger groups, 20 employees or more, the employer plan is actually sits in the first payer position. And then if you choose to enroll into Medicare A and or B, and you don't often have to, it sits in the second payer position. So in a small business, small company like our company size, we would have to the employee would have to enroll into Medicare Part A and Part B at 65 years in age and beyond, because the bill would pass through Medicare first, and then the second payer would be the employer coverage would pick up what Medicare doesn't cover. So with that being said, that can be extremely confusing, because if you're like, hey, Do I come off the employer plan? Do I stay on the employer plan? Do I go on to original Medicare? Do I enroll into a Medicare supplement? There's a lot of moving parts there. And I'm not going to get into the weeds of all of that, but just keep in mind that you need to be able to talk to somebody prior to when turning 65, be educated on exactly what are you planning on doing at the age of 65. And then how does your employer plan coverage work? Or if you're self-employed, what are you insured by at the age of 65 and beyond? Because you become eligible for Medicare at 65 years of age. You become eligible for most of you guys that are turning 65 this year and beyond for full retirement age of Social Security at 67. But it doesn't mean you have to wait to 67 for Medicare. That's another misguided communication that's often told to seniors because people are not educated on the process. So be educated 3 months to 6 months prior to your 65th birthday. Understand what you're going to be doing at 65 years of age. And then moving in, if you're going to enroll into Medicare Part A and Part B at 65, or you're coming off an employer plan and you're enrolling into Medicare Part A and Part B for the first time, you're going to be either eligible to enroll into a Medicare supplement for the first time as a complete underwritten free opportunity. When you turn 65, you don't have to underwrite, you don't have to ask health questions. You're going to fill out your personal information, and somebody like myself or our agency would collect some information, do an application for you, and there's no underwriting questions that would restrict you from the Medicare supplement. Or when you are coming off an employer-based plan, you're going to have a guaranteed issue period of time that you can actually enroll into a Medicare supplement plan. Now, if you're doing a drug plan, which most of you guys need to do, and you're coming off an employer plan, this is the most important thing I'm going to say about the drug plan portion of this today. And the only thing is you need to be able to do all that within a 63-day window of loss of credible coverage. So how do you eliminate that? Well, you start everything 3 months before you're 65 or 3 months before coming off an employer-based plan, talking to a licensed professional and ensuring that you're enrolling and eliminating any penalties that can occur with Medicare or Medicare Part B or Part A or Part D penalties. So now we're going to dive into what is the actual best Medicare supplement plan for 2026 and why. So how do we cover what is the best? Well, a couple of questions that we have to ask first when you're enrolling into a Medicare supplement plan. Typically there's 10 plans available, and some of those plans have high deductibles, and some of those plans have, kind of risk tolerances on the plan. So I'm not going to explain every plan available for Medicare supplements, but typically what we find is people that are enrolling into Medicare, original Medicare, and their birth date is from January 1st or January 2nd of 2020 and beyond, they're turning 65 from that period and beyond, they're going to be eligible to enroll into one of two plans that most Medicare beneficiaries are choosing now. And that's a Plan G and then a Plan N. So you have options here, and I'm going to explain both of those options to you so you understand how both of those plans are very similar, but how the Plan N is a little different, has some cost share that you would pay. And then why would somebody enroll in a Plan G? And then why would somebody enroll into a Plan N? And the differences are not that big, but they are important. And then understanding the structure of how much you're going to pay for each on an average. Then we're going to cover exactly what's going on in the industry that's affecting some of the premiums. And one of the big things, you're talking to friends and family and people that are on Medicare supplements, they may say, hey, my premium has jumped up in cost. And we're going to answer that question as well at the very end. That's very important on what to do to have the lowest premium. There's kind of a catch thing that you can do, and I'm going to tell you that at the end of this. So let's dive into first the Plan G. All right, so let's talk about the Plan G. Plan Gs are super simple in that Medicare, original Medicare, if you enroll into Part A, which you're entitled, if you've worked 10 years or 40 quarters, you're entitled to Part A, and it's premium free. Part B, you pay a premium for. Standardized premium this year is $202.90. Typically, there's a cost of inflation or COLA, cost of a living adjustment each year, roughly around 4 to 5%, can be up to 9% just depending on the year. But right now it's $202.90. If your income is at a certain amount and above as a single person or a married couple, then you may have IRMA rules that apply. And IRMA just means income related adjustments that can increase your Part B premium. So we have a video on IRMA if you want to be able to watch that. It's a great detail of how IRMA works and how it adjusts your Part B premium. But otherwise, it's going to look at the 2 years in arrears. So for in 2026, how much income, adjusted gross income did you make in 2024? That's going to base what your Medicare Part B premium is in 2026. And if you had a lifetime event like selling a piece of property or real estate or sold a business and you had a huge increase in your income that year, that that can actually be appealed and adjusted and lowered down, so you have a normal income adjustment for that year, and your Part B premiums is paid based on that. Now, the Plan G. The Plan G is pretty standard. You pay a premium, and that premium is going to be based on the zip code that you live in. So, like I live in Tennessee, the premiums here for Plan Gs are much lower cost than if we look at a state like New York or California. And the reason that is in other states, there's medical loss ratios that adjust those premiums, or the states themselves have adjustments within zip codes and things like that I won't dive into on this video, but we cover on other videos. And what happens is you have an adjustment premium that's higher in certain states. So you may have a $300 premium there for Plan G, but here on the average right now, we're ranging anywhere from about $138 up to about $150 a month for somebody that's aging into Medicare, turning 65 for a male. Females, you're going to have a little bit lower adjustment of premiums. That can range anywhere from about $115 to about $130 a month for your Part G or Plan G premium if you're turning 65. Now, if you're waiting and you're on an employer-based plan based on if you're 67, 68, or 70, each year you're going to have an adjustment, an increase in the premium. So if somebody's 68 years of age and they're a male right now, they may be enrolling into a Plan G for the first time and looking at premiums, and you may be looking anywhere from $140 to $160 based on your age and the zip code. So zip code is the indicator that determines what the loss ratio is for the insurance company. That's going to adjust the premium rates up. Now, what's the beauty about the Plan G, and why is it so important for you to understand the Plan G? And then why do most people enroll in the Plan G? I'm going to explain exactly 3 main details of the Plan G and why a lot of seniors now are still enrolling in the Plan G. So really the 3 things that you look at a Plan G. 1, you pay the premium. 2, you're going to pay a Part B deductible, which is the annual deductible for a Plan G. And then 3, 100% of everything for Part A and Part B services, inpatient or outpatient facility services that fall under Medicare Part A, original Medicare, is going to cover 100% of the cost beyond just the Part B deductible. It's really simple in that if you like to just pay a premium, have a very small fixed cost of a deductible every year, and then know 100% of everything's covered, then paying a little bit more for Plan G premium is well worth it because of just the ease of mind. And a lot of people that just like a fixed income, fixed cost, and just knowing that the only risk they're taking is the Part B deductible, because that deductible is going to be less than $300 right now, and over the next couple of years it's probably not going to raise very much above that. They have a very fixed cost and understand that when I go to the doctor or the hospital, the only cost I'm going to have for the year is my premium per month. You'll continue to pay that premium because that ensures the insurance stays in place because you're paying for it. And then the insurance performs based on you paying based on the terms of what that Plan G does, which is just Part B deductible, then 100% of everything else is covered. Now let's go into the Plan N. The Plan N works exactly the same way as the Plan G. The only difference is when you access care to a doctor, the doctor can charge an excess copay of up to $20. When you go to the ER, they can charge an excess cost of up to $50 copay. So you have a few copay costs and excess charges that original Medicare or Plan G does not have, the Plan N does. Now, why are the 2 differences and what happens in the 2 plans? The Plan G premium is going to be a little bit elevated higher. The Plan N, what we're seeing right now, can be considerably lower. Now, why is that important to you? And where does that lead us into the answer to this question that I asked earlier? You know, we're going to dive into what people do with this Plan N that makes it so unique, in that you enrolling into a Medicare supplement can actually ensure and create some extra, eliminate some extra liability that original Medicare doesn't cover and a Plan G doesn't cover. But the Plan N allows you to be able to do something else with your money that most people are unaware of. We're going to cover that next and finalize everything by just giving you a reminder of what to do if you do have questions about Medicare and don't know where to turn. So what is so amazing about the Plan N? Well, a couple of things. 1, original Medicare, Part A and Part B does not cover like dental, hearing, and vision. So if you are a person that's been in a major medical plan and you've had a small copay cost when you went to the doctor, and maybe a small deductible, and then you had like dental, vision, and hearing, and you're coming into original Medicare, but you want to pay for a premium, have a Medicare supplement, have the ability to go to any doctor, any hospital, any facility that accepts original Medicare. One of the biggest reasons why people choose a Medicare supplement, either G or Plan N or any of the supplements, is the flexibility of no network, Also, they can go to other places, other locations. They could travel anywhere in the US and get coverage and care by a doctor, by a hospital that accepts the original terms of Medicare. So that gives you all the flexibility that you need. Now, the unique nature of the Plan N, because you have some exposure to some copays, it actually suppresses the monthly premium. So what are seniors doing now with that additional money? If you go from $140 down to about $105 or $110, typically there's about a $30 or $40 a month savings. Most of our seniors are looking at adding on a dental, vision, and hearing plan, or dental and vision especially. If they don't have hearing issues, a lot of times they'll kind of shelf the hearing coverage, but they're looking at something like VSP for vision, which is a very low cost per month coverage that provides eye care when it comes to routine exams, eyewear coverage and things like that. And then the dental, depending on your area, either an HMO or PPO or what we call open access dental plans where it has a national network, both of those coverages typically can be insured for about $30 to $50 a month. So the cost of a Plan G, you can go over to a Plan N, have the exposure up to a $20 copay when you go to the doctor. So if you go 4 or 5 times a year, you have an $80 worth of copays. If you were to go to the ER, which is not very often, you would have a $50 copay, but then you take the additional money monthly that you're saving from the premium and you actually insure the other liability risk, which is like dental, vision, and can be hearing. So that's huge. And adding on top of that, do not forget to add a prescription drug plan. Drug plan coverage is not available through original Medicare or the Medigap or Medicare Supplement plans. You have to add the drug coverage to cover your medications. And even if you're not taking a medication, right now we have drug plans in our market at as low as $3.60 a month. So you can ensure your medication is going to be covered. And in the future, if you did not choose to enroll in a drug plan and in the future added a drug plan, Medicare actually charges you a penalty based on the national average Medicare prescription plan drug plan average premium, which right now is about 42 cents a month. So that means if you went for 50 months, you'd have 50 months time about 40 or 42 cents. So that can build up very quickly to penalize you in the future if you needed a drug plan, when you can actually add a drug plan right now. Most people even not taking medication, anywhere from $0 up to about $10 a month in premium. So that's very important. Lastly, making sure that one of the greatest things that you can do is actually building relationships with a licensed agency and professional that you trust, know. This person can be the person that you call when it comes to questions and answers, and then guidance like what we're doing here today on this video. Making your life easy by making Medicare simple is really what Medicare Hub is about. If you don't have an insurance agency that you would like to be able to reach out to, I want to invite you to be able to take the time, click below, schedule a time. We'd love to do a free consultation with you. We're going to walk you through identifying what your problem is, trying to make sure that you understand how Medicare works, simplifying that down, figuring out what plan is going to be best for you, and then walking you through that process, getting you enrolled in the plan of your choice. And then at the back end of our customer service can always be available for you to call in, answer questions, and guide you through most difficult situations with Medicare. Sometimes has problems, or your health plan has problems, and you're looking for that answer, you're able to call into our customer service team. We're able to serve you. Guys, you can click below. Otherwise, I will see you on the next video, and have a great day.